Morning. Good morning. I wonder whether I'd have anybody in after the England match, being so well late at night. I was going to say, but early in the morning this morning. Welcome if you are in. It looks like we do have a few people in this morning, which is good. Just check everything's working. That's all looking good. Perfect. So what we'll do is we'll catch up where we left off last week. We were looking at some of the muscles in the neck, and then we're going to add on the hyoid muscles, so this bone in the neck that we've been talking about over the last couple of weeks. And then once we've done that, let me just shut a few things down on my screen. There we go. Well, yeah, once we've done that, then we're going to start having a look then at the nerve roots in the neck, which will then build up or build out into the brachial plexus. So that is the plan. Let's go in where we were. So this is where we were. We were having a look at the posterior neck. Good morning, Tris. Good to see you there, mate. Good morning. Yeah, so we did a few of these, and then there was a couple that we didn't do as well. So we did semispinalis, capitis, and we were talking about the different layers of tissue, and had an interesting one the other day, because you can get a lot of subicogenic headaches from the musculature and the joints in the neck. So actually they got headaches, but there's nothing in the head causing it. It's a neck origin headache, and quite often you'll get referrals from this area as well. And so you kind of push in around this area here, and then it refers up into the base of the skull, sometimes into the top of the head, sometimes into the around to the front, like a real kind of eyeball headache. So yeah, you can get all these sort of different referral patterns around that area. And there's one patient that I've got that gets a what she describes as a Teletubby headache, which is right on the top of her skull. And that is a referral from this one. So we've got splenius muscle. And this splenius muscle is around about this area here, and if I press into there, then it reproduces the symptoms on the top of her head, and that's the kind of problem that she gets. Same with had a patient once as well with an issue with pain in their ear, like right in their ear hole, and they'd been to the doc and everything all checked out, and there was nothing wrong with their ear, and it's actually a common referral from muscles in the front of the neck, like the scalenes. And again, just having a bit of a poke and a prod in there, and then found this one spot, and then it was referring into the ear. So definitely have a look at those kind of things. So they're muscle referrals. Yeah, you're welcome, David. You're welcome. Good to see you back on the Monday. Yeah, all good. Good weekend, busy weekend. This weekend, as usual. Got another one lined up, busy as well. Yeah, that was splenius, and then we had a look at trapezius as well. So we looking at the different fiber orientation of these. And there's another little muscle as well. So I'll show you on this side. We'll cover this more when we get to the shoulder rather than the neck, although it does obviously attach into the neck. But you've got a muscle that attaches right on that superior angle of the shoulder blade, superior angle of the scapula, up to C1, 2, 3, 4 on the transverse processes there. And so that's called levator scapula, and it will literally elevate your scapula. So the fiber direction is a bit it's a bit of a twist to it, but it goes up into the neck. So muscles can only contract, and so they can only pull. So it will literally pull your shoulder blade upwards. The trapezius muscle, and I've mentioned this a few times, so apologies if you've heard it all before, but the upper trapezius, the fiber direction is oblique, and then the middle part of the trapezius is horizontal towards the spinous processes, and then again we've got an oblique fiber direction coming down here. And if you have a look at the attachment points, so what one of the common exercises in the gym, if you wanted to, so let's say you had someone with really like tight trapezius. One of the reasons why they feel tight, they get that tightness, is because of fatigue. So we can induce some fatigue resistance into there by doing some exercises to help with the capacity of the musculature to help them cope with whatever it is that they're doing. So one of the exercises commonly given is shrugs, where you just shrug your shoulders up. But because of the fiber direction of the trapezius muscle, yes, it is involved in elevation of the shoulder girdle, but it's more so this levator scapular muscle in here, and quite often they'll complain of, that knot right on the shoulder blade sort of area there, which is the insertion of trapezius. So it's a bit like a tendinopathy of the levator scapula. So if you want to maximize the effectiveness of the contraction of a muscle, the best position to have the muscle is in a mid-range position. Okay, so if you're doing a shrug with your arms down by your side, because of the position of the shoulder blades, then the levator scapula is in a perfect position to be the big contributor towards that movement. And because of the orientation of the fibers of trapezius, yes, it will assist, but it won't be working most efficiently because it won't be in a kind of mid-range position. So what you can do is you can do something called a monkey shrug. And if you have a look on the YouTube channel, my YouTube channel, MSK Education channel, and search for monkey shrug, there's a video of us doing it in my gym. And basically you do a movement like, just get that arrow out of the way. So you bring your arms up like that. So the shoulder blades are then upwardly rotated, and then you shrug from that position there. So what then happens if we go back to this one, not that one, that was the other week, that one. If we go back to here, so because when you bring your arms up, you get an upward rotation of the shoulder blade, so it tilts, okay, and then that point there will tilt closer. So at the moment that's quite stretched, and then when it tilts closer, it's then more in a mid-range position, and the fiber alignment is better for it to be able to do a shrug. So you get a better contraction of your upper trapezius with a monkey shrug. Okay, so bringing the arms up to the side. But the tendency is to do an upright row. So you row it rather than shrug it. But you've got to keep the arms still and then just elevate the shoulder girdle from that position. And it burns. It's a proper trapezius burner. Okay, so having an understanding of the anatomy and then how that changes when the shoulder blade moves is really important for being more specific with exercises. You can't isolate structures around here. There's too many muscle attachments going on, but you can bias some muscles more than others. And if you have your arms by your side and shrug, yes, it will work your trapezius, but nothing like if you have your arms out to the side, so abducted slightly and then lifting up. Hi Deborah, good to see you back again. So just a little tip on that area. I always mention it when we come to the trapezius because that's something that's quite often mentioned. So the function will change as the shoulder blade moves for the trapezius. Right, let's have a look at not that one. Don't want that one just yet. Hold on. Oh yeah, we did it this way, didn't we? I think probably because of the size of the screen, Lizzie, you're better off having a look at that video. Best thing to do is go to the YouTube channel and search up shoulder shrug. It's a bit you're abducting the arms and then shrugging from that position. It's a little bit hard to to demo that one right on a small screen. Right, why is that not there? See if it's in this one. Bear with me a second. No. Okay, never mind. Well, we saw it before anyway. And then we've got this muscle here, sternocleidomastoids. Let's just see if we can find that. Hold on, I'm having a bit of a video malfunction. I've got so many screens here. Let's have a look, see if I can find it. Bear with me a second. So I'll see if I can find the trapezius. There we go. That's it there. First. Here we go. Okay, cool. So here's your trapezius. Not the best layout, but there we go. We got there in the end. So there's your occipital ridge, just around that area there. Your spinous processes are around here. That's the spine of the scapula, and then you've got the acromion around that area there as well. So you can see the different direction of all of these fibers of the trapezius. So I'm just going to play this through. So there's the upper fibers there, and then you go along the spine of the scapula and then into the middle fibers, and then they come down into the lower part of the thoracics as well. So occipital ridge onto that spine of scapula. So that's why when you move your shoulder, you will get a just put that in the middle. You'll get a different activation of those muscles. Yeah, so if that point there just gets closer, then it will change the length of those muscles. And there's the front of the trapezius there. So in terms of manual therapy, I'm just going to pause that one when it gets to that point again. In terms of manual therapy, a nice place, let me just pause that there. So a really nice place to work on, because often you do manual therapy to the posterior aspect of the trapezius. So you have a shoulder rub, but actually the trapezius also is accessible anteriorly. So this around this area here. And so you can have someone lying supine and then apply pressure to the anterior part of the trapezius as well, and that's often an area that's a little bit of a hot spot. So there's a nice place. Yeah, nice position there. See that? You can just see the fibers poking through. So around this space here, the scalenes are here. So they're just behind the scalenes, and you can get right onto that trapezius. You can use a kind of like pincer technique for that. I like to put one hand underneath, so on the posterior aspect of the trapezius, and then fingertips on the front. So we try and like kind of like a trigger point type technique, and then moving the head whilst they're supine, as well as just treating it from the back. So yeah, that's trapezius, and then just get rid of that one. Then we've got sternocleidomastoid. Bear with me a second, just find that one. Here it is. Here we go. Okay, and this one is a bit of a whopper. So this is your jaw just here, and then that bit there is called the mastoid process. So if you have a feel on yourself, it's just behind your ear. Yeah, so ear's just there, jaw's there, and the mastoid process is there. You can see the sternocleidomastoid quite easily if you turn the head. So it rotates the head to the opposite side, and it's got kind of two bellies to it, but merging into one. So you've got the sterno bit, which is the sternum, the cleido bit, which is the clavicle, so it attaches onto your clavicle as well, and then the mastoid process of the skull, so up there. So that's your sternocleidomastoid. It's a really, really big muscle, powerful rotator. There you go. So it's got quite a large footprint on that mastoid process around the back as well. And again, you get some real like headachy referrals around this area. There it is there. Look. So there's your two heads. So the clavicle portion and the sternum portion just there. So hence the name. sternocleido, and then mastoid. So this kind of links in all of that area that we saw before. It creates this notch at the front as well. Okay, so we've got the angle of Louis at the front, where basically the top of the sternum is in that point just there. So that's your sternocleidomastoid muscles, and where you can see there, if you kind of rotate one way and then side bend your head to that side, it really fires that muscle up. And again, that's a nice way, if you're doing manual therapy, to be able to lift that muscle away from the other tissue that's underneath, because you can see it's quite close to the throat, yeah, around this area here. So and it can feel a bit pinchy, but if you have someone's head on a pillow, rotate and then side bend, then it just lifts that muscle up so that you can grab hold of it and do kind of, again, like trigger point type techniques around there. Cool. So that's your sternocleidomastoid, which is that muscle just there. And then we've got this big bit of connective tissue. This is a really interesting one called the platysma. So this is fascia over the upper pectoralis major and the deltoid, basically the skin of the upper chest. It's your gurning tissue. So if you've never heard of gurning before, then have a Google of that. That'll keep you entertained for the morning. But if you do, again, if you're in the UK, you'll get this reference hopefully. But I think it was British Gas did the Aardman animations, and there was a tortoise on one of those adverts, one of those commercials where it said things being very turn off and honourable. And okay, if you have never seen those, you'll have no idea what I'm talking about. But if you do a kind of like that kind of tortoise face and just kind of like tense your jaw, all of that area there, that's all platysma. Okay, and a really, really nice thing, because this often it feels tight. It doesn't really get tight, but it feels tight. So you can bring the head down onto the chest, you can hold onto it, and then you can just bring the head up in different directions, and that's a really nice treatment. You can use a muscle energy technique for it, because obviously get the muscles involved as well. But what you've got to be careful of with this one is because it of the pull on the jaw. People often, when they lift their head, they open their mouth, and then that takes the slack out of the platysma. So you've got to keep the mouth closed as you do it, and up in different directions. But that's that's a bit of connective tissue that kind of goes all the way over the front of the throat, up into the jaw, all over the front of the chest. Okay, so that's quite a widespread piece of connective tissue. Cool. Okay. Then we're into the hyoids. So if you've never heard of the hyoids before, there's a little bone in your throat, and you should be able to feel it. So if you feel kind of like sides of your jaw and then down, where you can feel your windpipe, either side of your windpipe, you should be able to feel like a couple of bony projections either side. So you kind of like, there's cartilaginous tissue as well, and because you thyroid is around this area, but if you have a bit of a push around, you should be able to feel a couple of distinct kind of bony nodules either side of your throat. You don't want to push too hard, but you can definitely feel it. So it's yes, up around this area here, and what you can feel are these projections just either side here. Yes, we've got the main body at the front. And that kind of merges with the connective tissue, that area there, and then we've got these kind of like, it's kind of like a transverse process, but side sticky out bits of the hyoid bone. So it's a U-shaped bone in the midline of the neck, below the mandible, so below your jaw, at the level of roughly at level of C4. So if you go here and then you come backwards, then roughly that's C4. Okay, so pretty much bang in the middle of your neck, just above the thyroid cartilage. So that's what I mean. You can feel the cartilage, and if you swallow as you're feeling that area, then you can feel that, you can feel the cartilage and the bone move. It's unique. It doesn't articulate directly with any other bone. Yeah, so it's literally just purely held up by muscles and cartilage suspended in the front of your neck. So it's there's an anterior triangle of neck of muscles from the larynx, pharynx, the tongue, and the floor of the mouth. And hyoid comes from the Greek hyoides, I think that's how you pronounce it, shaped like the letter upsilon, which is a Y shape. So that's where it gets its origins of its name, the etymology. So we've got 7 muscles around this hyoid. We've got 2 that pull upwards and forwards. We've got 1 that pulls upwards and back, 1 that pulls upwards like a pulley, and then 3 that pull it downwards. Okay, so we've got 7 muscles altogether, all kind of working synergistically to maintain the position of this hyoid bone. So useful words for this next section. Ramus or rami means a branch. Okay, so a branch off of something. Dorsal means towards the back, so like a dorsal fin on a dolphin. Ventral means towards the front. Milo is to do with your molars, so your teeth. Di means 2. Gastric is a belly, so like gastrocnemius is a big belly muscle in your lower leg. You've obviously got your gastrointestinal area because of belly. Omo means shoulder. This is an interesting one because your neck at the front attaches to your shoulder blade, and it's a really nice little anatomical kind of geeky fact. Yeah, I'm pretty sure off the top of my head there are 17 muscles that attach to the shoulder blade, and one that most people don't get is the omohyoid. Okay, so now you know. Genio means to do with the chin, and then stylo is a pillar, okay, or like a stylus, like a pen, that kind of shape, so a long cylindrical shape. So these names will be useful as we go through what the muscles are called. So the suprahyoid is superior to the hyoid bone. So remember, middle part of your neck. So anything superior to that is going to go upwards, either to the bottom of the tongue or the jaw, that kind of, so the floor of the mouth, basically. Okay, so these ones all help to elevate the hyoid. So this is your morning, Penny. These are your mylohyoid muscles. So these are to do with the molars of your teeth. So from the mandible, so you can see that bit there. So if you have a feel of the mandible, it's going to be in that region there. That's where this mylohyoid is going to be. It's from the body of the hyoid, so that bit at the front, and then elevates the floor of the mouth. We'll talk about the nerve supply as we go through. So this is your mylohyoid muscle. Here it is. Right, so just move that there. There. Okay, cool. So this is looking at the inside of a jaw. So that's a mandible there. Obviously, the teeth there. There's the chin, and then the other side of the mandible. So this will be your where the jaw would join your skull. So the TMJ, temporomandibular joint. So this part here is the mandible. There's your hyoid bone, and then these are the muscles that connect upwards. So they're forming the floor of the mouth. I'm going to play that through there. So mylohyoid muscles, it's like a stirrup. Yeah, so we've got this kind of like hammock type shape. So there's the attachment points there, the mylohyoid lines. And then that you can see the body. So they go downward immediately, and then they join the hyoid onto there. There is a join in the midline of the two of them as well, and then that's where it attaches at the front. So you can see this kind of like hammock or stirrup area. There's a free border at the back here. And there's a little gap there, which will be useful when we get onto the nervous system later and for other muscles. Cool. So that's your mylohyoid, and then you got your geniohyoid. So this is another one of those muscles that forms the the floor of the mouth. Okay, so from the mandible to the body of the hyoid again, will help to depress the mandible and elevate the hyoid. Okay, so again, similar kind of roles to the mylohyoid from before. So this is the geniohyoid this time. Remember, genio is to do with chin. So there's your mylohyoid from before, and then there's your geniohyoid. Yeah, so it's even deeper than the mylohyoid before, attaching to a very similar place. But if you remember, on the front of the hyoid body, the mylohyoid attached a little bit lower down, so there's a bit of room for this geniohyoid to attach to. And again, it's forming that kind of stirrup or hammock of the floor of the mouth. So there's the attachment point there. Just go back again, have a look at that. Okay, so mylohyoid there's the body of the hyoid bone, and then there it is there in the middle. Okay, so similar kind of fiber direction as well, kind of crisscross each other a little bit, and it's on top of the mylohyoid, so superior to that, and then there's the attachment just there. So that's your geniohyoid. Then you've got the pillar one, okay, or the pen one, the stylus or the styloid. So stylohyoid, this is really, really thin pillar, okay, got that there. And again, we've got the styloid process of the temporal bone. So that's this bit here. So where the mastoid process is, so that's the auditory meatus there. That's the opening for your ear hole, basically, just there. So just behind that, you've got the mastoid. Just in front of that, you've got the styloid, okay? And it's the styloid process of the temporal bone. And then it goes onto the body of the hyoid. So literally from there to there, and its only job is to elevate the hyoid bone. So let's have a look at that one. So this is the stylohyoid, and it kind of like just suspends. It's mad. So there's your mandible, there's the styloid, mastoid process just behind, and then there's your stylohyoid muscle there. Okay, again, like just a bit like a suspension. This is the really cool thing with this, actually. Let me just bring that back. So it's got a split in it, this muscle. So I don't know whether you can make it out. You can definitely see it there. So see him pulling it apart there. So there's a split in that, and that's useful for later. There's your styloid. So that's up there just in front of the mastoid process. And then it attaches onto the side portion, that greater horn of the hyoid bone. Let's just have a look at that again. So there's the hyoid bone, mylohyoid just there. There's the styloid. Too many oids in this one. Stylohyoid muscle with a split in it. I'll have a look at that one later. Okay, so you can see everything's kind of like suspending this hyoid bone in place, and then there's the attachment point. Cool. So that's that one. That's what that looks like in real life as well. So yeah, again, the hyoid bone being suspended this way, and you can see some of them will elevate and bring the hyoid bone forward. This one, because of the orientation of it, will help to elevate and bring it backwards. So we've got that muscles doing all the opposite jobs to keep things in place. Now, this one's an interesting one. This is the digastric, so 2 bellies. Yeah, so we've got a belly at the front attaching onto the mandible, so that there it is there, so anterior belly, and then a posterior belly goes to the mastoid. Yeah, but there's like a central tendon in the middle. There's an intermediate tendon. There you go. So, and remember that split in the stylohyoid. Well, that will become a bit clearer with this one. So this is the digastric, 2 bellies, because it's got 2 muscle bellies. So there's your digastric muscle, but look where it's going through. Yeah, so anterior belly down here, and then it curves up and it passes through that stylohyoid muscle. And then there's the attachment point up here. So just around about that mastoid process. So we've got quite a few big muscles attaching up here. I mean, we've already had a look at one. I'm just going to pause that there. So we had a look at sternocleidomastoid as well. Remember, that sits on top of this muscle. So these are all going on underneath that sternocleidomastoid, kind of SCM protecting all of these small little muscles. But look at that. So there's the posterior belly. You've got this central tendon, and then the anterior belly there attaching onto the mandible. And then it passes through that stylohyoid muscle. Remember, it had that split in it, so it passes through there. Just going to take this back. So digastric, 2 bellies, mastoid process. There's the posterior belly. There's the anterior belly. There's the tendon in the middle. You can see it passing through that stylohyoid. That's just the showing the attachment points, and that's it there, coming through and then scooping around. So again, we've got more kind of hammock type muscles just suspending this in place, and that's the attachment point just there. So there's a bit like a slip of a tendon coming through for the attachment, and then on the undersurface of the chin, so right underneath your chin. So it's all that area there. So there's a cross section, so that bit just there. Who knew, eh? There's so much going on with that hyoid bone. So those are your suprahyoid muscles. Yeah, remember there were 7 altogether. So now we're on to the 7 hyoid muscles altogether. Now we're on to the infrahyoid muscles. These ones will do the opposite job. So these will depress the hyoid downwards. Now the video for these is all 3 in one. So we're going to show you all of the slides, and then we'll go to the videos. So if you have a look here, there's the hyoid bone again, and this one's got two bellies as well. This is the omohyoid, and it attaches onto your scapula. Yeah, how mad is that? Yeah, so there's a muscle that goes from the hyoid bone, splits into 2. So there's like a little central tendon on this one as well, and then onto the middle part of that superior border. Yeah, just in there. So supraspinatus will be around here, and it sits just anterior to that on that superior border. So the inferior belly, superior border of the scapula, superior belly, intermediate tendon. So that's the attachment there, or the origin, if you like. And then we've got intermediate tendon, and then the superior part of the muscle attaches onto the hyoid. So up here, and again, because of its attachment point and because of where it attaches to, it can only pull, so it has to depress the hyoid. Yeah, it's the only thing it can do. Then you've got the sternohyoid, so from the sternum to the hyoid bone, and again you can see here, so similar to the SCM with the name sternocleido, this is sternohyoid, and there's your sternal attachment, very close to the sternoclavicular joint, and then coming up onto the bottom part of the hyoid as well. So sternum and clavicle onto the hyoid, and again we'll depress the hyoid, so it'll bring it down, working against all of the suprahyoid muscles. And then we've got the thyrohyoid, which attaches onto the thyroid cartilage. Okay, and we'll have a look at that in a sec. So, and then the attachment points onto the greater horn of the hyoid. So the kind of, not the body bit, but the horn sections at the side. So that's your last one. Let's have a look at this video. So this is thyro, sterno, and omohyoid muscles. There they are. It's amazing. Okay, it's just mad, isn't it? How like you've got a hammock kind of portion up here, and then it's tensioned by the muscles down here. We've got these omohyoid coming backwards, sternohyoid coming forwards, so that we've got that anterior and posterior depression of that hyoid bone as well. I think hyoid's one of those words that I'd struggle saying again. So that one's going towards the shoulder. This one's going towards the sternum. And you can just see how it just, look at that, it's just suspended there. And then there's your thyrohyoid. So that will go either side of that, will attach onto the thyroid cartilage, which will sit in there. So these are your attachment points, edge of the hyoid body. And then obviously if it's more posterior, more anterior, depends on which muscle is attaching. And then there's your thyroid cartilage. Yeah, you can see the shape of the hyoid bone. Exactly, it just mirrors the thyroid cartilage. And then this will be where it sits in situ. So thyrohyoid changes into the sternothyroid, which I think we looked at last time. So onto the thyroid cartilage. There's your sternothyroid. We didn't look at that on the main slides just because it's not attached onto the hyoid bone, but that comes down to the back part of the sternum, so into the thoracic cavity. So omohyoid going towards the shoulder, sternohyoid coming down onto the sternum. Yeah, you can see the different directions of those. Look at that one coming out over there. And then that will come down into just behind where the clavicle is. There's your omohyoid muscle. And that will come all the way onto the front of the shoulder. There's the trapezius just there. So we had to look at that earlier as well. There it comes through, look, just there. So it attaches right around there. So where that suprascapular notch is. Just going to play that through again, so that's pretty cool. Okay, so omohyoid going towards the shoulder, sternohyoid from the hyoid to the sternum. There's your hyoid bone in the middle. Your cartilage would be here. That's the muscle that attaches onto the cartilage. These are your attachment points onto the hyoid bone itself. So thyrohyoid posteriorly, sterno and omo anteriorly. And then there's the thyroid cartilage. Hyoid bone is the same kind of shape. And then there it is in the neck. So there's your thyrohyoid part. And then that changes into the sternothyroid. So it goes onto the sternum and onto the thyroid cartilage. So sternothyroid. Again, it's quite logical with the naming of them, just go from where they go from and to. And then we'll start to add on the hyoid ones. Here we go. So there's your omohyoid, sternohyoid, which is what we've just been looking at. And then there's the attachment points on the anterior part of the hyoid body. Sternohyoid muscle comes all the way down, and again that drops down just behind the manubrium of the sternum. There's your omohyoid, clavicle's just there. There's your trapezius. And then there's this inferior belly just coming down here. So all of brachial plexus will be around there. And then it attaches right onto that superior border. Cool. Perfect. So I was going to make a start on the nerves, but I think that's a good place to finish, and we'll do those next week. So we've got the the nervous system next week. We're going to have a look at the nerve roots, and then we're going to start to add on the brachial plexus. Okay, so that's the plan for next week. If you have any questions about today, it looks as if there's stunned silence in the comments today. Always is with the hyoid. No one really looks at the hyoid, do you know? With we go, oh yeah, there's hyoid muscles. We know about that, but not really drilling down into the detail of it and what each of them do. So more stunned silence next week with the nerve roots. Going to have a look at something called or the differences between dermatomes and cutaneous fields, and because they can get confused quite easily, so we're going to have a look at those. And then if we get through that, then we'll start the brachial plexus next week as well, so we'll see how we get on with timing wise. Otherwise, I will see you next Monday at 10 o'clock. Have a good week, everyone. It's going to be a heat wave, and get the aircon on. See ya.